Hi folks, today is Tuesday, December 29th. So 2 days left in this godforsaken year. Can't wait for it to be over. I'm sure you feel the same. A few things that are going on right now. We have a lot more spread in our local counties, Hillsborough, Stratford, and Rockingham, in the 15% positivity range. And we're starting to see that in tests for our staff. So we test over 500 people a week between the 3 campuses in Exeter, plus Birchill and Riverwoods, Durham. And right before Christmas, the week before Christmas, we had positive cases in all communities, including at least one positive resident, healthcare resident in each community. So it's certainly concerning. We continue to remind our staff about a small life and masking and keeping their social circle small and washing their hands. And just want to give you that same reminder. The more we do to limit our interaction with others, the more safe we are. And it's just math. The other thing that we're experiencing within each of the communities, not only some staff testing positive, but staff who need to be out because they are quarantining due to an exposure to someone who was positive, whether that's someone in their social circle, in their family, someone that lives with them. So that does have some of an impact on our ability to have a smooth operation. And I appreciate the flexibility and patience that you all are showing us at this time. A few things to talk about. We have had a few people talk to us about, why aren't we tightening up our standards within the communities? So for you, why aren't we being more strict about leaving campus and so on at this time? And comparing it to where we were in the spring when we were sort of a closed campus. And the reality is there are some things that are very different now between March, April, May, and today. Yes, the virus is still spreading and spreading more so as far as we know. That's a negative. But the positives are, number one, in the spring, we weren't sure whether or not primary transmission was person to person or secondary item. So if I'm positive and I touch something, is there a very high likelihood that someone else would become infected? And what we've learned over the course of the last 10 months is that that's not necessarily the case, that there is a possibility of secondary transmission, but that's fairly low. And the likelihood is that the virus is spread person to person. We have, since the spring, much better access to personal protective equipment to keep people safe. We have access to some therapeutic drugs. And most importantly, we have access to much broader, faster testing. And that is, for us, that has allowed us, even though we've had some staff members and some residents test positive, it's allowed us to limit the spread, limit the transmission, because we can stay, as much as we can, stay a step ahead. The other thing I'd want you to know is, while nursing homes and assisted livings around the country have been hit very hard by the virus and transmission and transfer within communities, that's not been the case on the independent living side in communities such as ours. And that's just primarily because staff is able to stay away. They're able to, by the nature of their jobs, maintain some distance. They're able to ask you to leave your apartment when they're performing a service. And you all, are making good choices about maintaining distance, not eating with one another, keeping your mask on, and doing all that you can to keep yourself and your neighbors safe. Last thing I do want to point out, though, that if you're nervous, if you are someone who would prefer less risk in this area, you have every right to tell us you want to self-quarantine. We do have some folks within the communities who have done that, and we'll take care of it. We will bring your food, we will take your trash, we will do all of the necessary services, bring your mail, so that you can do that and live at a level, at a safety level that is comfortable for you. The last thing I just want to touch on is, see my shirt today is keep calm and get vaccinated. The vaccines are coming. We have our date for Riverwoods Exeter. That is tomorrow, December 30th, for our first round. The rollout, in my memo, I call it rugged. If I was not being videoed, I might use a different term. It is a very complex process. It is not smooth. It is not gentle. But if in the end what we get is a working vaccine into a lot of people's arms, that's okay with us. So we're going to keep at it. We don't have our dates yet for Birch Hill or Riverwoods Durham. We anticipate that those will be coming very soon. Riverwoods Durham's date is not, we don't have that yet because it doesn't have the nursing home portion licensed yet. So it's considered independent living and assisted living. And that's those dates, we didn't anticipate those dates until after the first of the year. Birch Hill, we should have dates any moment. We are waiting them as eagerly as you all are. We are nothing short of annoying to our friends at CVS in every effort to get you vaccinated, get our healthcare residents and our healthcare staff vaccinated as soon as possible. Our expectation is that once the state is through all of the nursing and assisted living communities, that they will add in, and as the receipt of new vaccine doses arrive, they will add in the independent living communities. And what I can tell you now is you'll know the minute we know that we'll have a clinic on site, and when it will be available for you. We'll handle the paperwork. You just come down and get a shot in your arm. So we're super excited about the vaccines coming. Last thing I would just say is that getting vaccinated doesn't mean that you can go around and hang out with big groups of people and kiss them on the mouth. We're at a point in time where we're going to need to keep wearing our masks for a while and keeping everything small, but an end is coming. There's a light, not just a big glowing one over my head here. There's a light at the end of the tunnel. And what I tend to think of it as progress is coming in stair steps. In the spring, I would say every 4 weeks, science makes a big jump. And science has made a big jump, to have vaccines available that are 95% effective is fantastic. We're not hearing very much about any difficult side effects. That's fantastic. They're seem to be very effective for the older generation. That's very fantastic. We just probably have another few months of a little bit of waiting, a little bit of taking our vaccine, a little bit of immunity growing, and then a little bit of waiting for the outside world to catch up. So good things will happen. I promise there will be some good things in the spring. There will be some great things in the summer. We're going to get there. So with that, I would just say, wash your hands. Please keep your social circle small. Stay out of crowded places. Stay out of places that you don't need to be in, where there are people you don't know, and wear your mask as much as possible. It's not that hard. Okay, thank you, and stay healthy, my friends.